Hello everybody, I am Dr. Richikasahayshukla. I am the Director of India IVF Fertility, and today in our fertility series I'll discuss a very important topic that most of the patients ask me, because now most of the females, they are working, they ask me how to maintain a work-life balance during the fertility treatment. Do I need to quit my job? So let's discuss this today, including the male partner, because it's not that only they have to give the sperm. Their emotional and financial things also have to be kept in mind, because the stress from one partner gets transferred to the other partner as well. So giving you just some tips, because I cannot take your pain, but obviously I can make the journey smoothen. So giving you some tips about the work-life balance. First and foremost, always plan your IVF cycle. If you have got problems during that period, like if you want to visit some function or there's some important work in your office place, that is very important, like a meeting, or like your the bank employees, they come, they have got year-end closures. So don't plan your IVF cycle that time, because that stress level is going to affect your outcome, your ovulation induction cycle, your embryo transfer implantation. Secondly, since the IVF cycle is very planned, always discuss it with your IVF clinic, the doctor and the staff, that you are a working woman. They should know it beforehand, so that they can reduce your visits to the center, and that has to be planned so that you can plan it ahead. So if things can be planted ahead, like the blood samples can be have home collection by the center can arrange a home collection for you. Secondly, all the visits are planned, because the cycles days are planned, the scans are planned. In that case, you can take leave according to that. And obviously, once you come to the center, there is a time only that you have to be at center. After that, you're free to go. So that time you can use. You can tell this, you can share this. If the boss is good, you can share with the boss also, so that the whole day leave is not there. Secondly, on the day of ovum pickup, definitely you need 1 day leave. There is nothing that you need a whole cycle of leave when you're going for IVF cycle. If you're going for a frozen cycle, only on the day of OPU you need the leave, then you can go back. If you're doing the embryo transfer, then obviously 3 days of leave, 72 hours of leave is what is warranted. There is no role of bed rest in IVF. So don't target bed rests in IVF cycle. So this 72 hours is sufficient, and that also not to bed rest. This is basically given to the patient to optimize the cycle, so that you are taking medications on time and these kind of stuff. Secondly, you will be having more of white discharge during the IVF cycle, because there will be copious discharge, because there will be more of eggs formation. So you can plan your life. You can use panty liners, you can use some loose dresses, because maybe you'll have some bloating in that time. So these ways you can manage your work-life balance, because you'll be mentally prepared for it. You need to have good amount of nutritious food, you need to have good amount of water to keep you hydrated. So these things you can maintain in the office, so that for everything you don't have to run. Plus, there are many things. Earlier, what used to happen, females used to say, okay, we are not going to pass urine there, we are going to hold the urine. So don't do that. Nowadays, there's a very good things, like many things are available which you can use for passing urine without sitting on the commode, without having an interface, so that the infection is not there for you. So these are some very small tips you can follow, and you can maintain a work-life balance, and you can continue working during the IVF cycle. Keep your stress levels low, because obviously when you are working, your mind is somewhere else. So in that way, you can be very positive, and you can still continue working and undergoing the IVF cycle, including the male partner, because they also have to plan their visit. So when the semen is going to be taken, everything, once you take a chart and make out of it during the IVF cycle only, you will not fall in this haphazard pattern, and you will not feel the pinch of undergoing the IVF cycle on your work hours. Thank you. We care about you.